Oral cancer. Oral cancer refers to a cancer that grows on any of the parts that make up the mouth. Oral cancer can occur in lips, gums, the tongue, the inner lining of the cheeks, the roof of the mouth, lower lip, under tongue. Cancer that occurs inside the mouth is sometimes called oral cancer or mouth cancer. Oral cancer is one of the most common cancers collected in a category called head and neck cancer. Cancer of the mouth and other cancers of the head and neck are often treated similarly. Symptoms, signs and symptoms of oral cancer can include oral or oral ulcer does not heal, white or red patch inside your mouth, loose teeth growth or lump in your mouth pain, ear pain, severe or painful swallowing. When to see a doctor, make an appointment with your doctor or dentist if you have persistent signs and symptoms of anxiety that can last for more than 2 weeks. Your doctor may investigate some of the most common causes of your symptoms and signs, such as infection. Causes. Mouth cancer develops when cells in the lips or mouth undergo changes, mutations, in their DNA. The cell's DNA contains instructions that tell the cell what to do. The mutations in genetic engineering tell our cells that they must continue to grow and divide when healthy cells die. Abnormal oral cancer cells can form a tumor. Over time, they can spread from the inside of the mouth to other areas of the head and neck or other body parts. Cancer of the mouth usually begins with flat, small cells, squamous cells, that line your lips and inside your mouth. Most oral cancers are squamous cell carcinomas. It is not clear what causes the mutation of squamous cells that lead to oral cancer. But doctors have identified factors that can increase the risk of oral cancer. Risk factors. Factors that can increase the risk of oral cancer include use of any type of tobacco, including tobacco, pipeline, chewing tobacco and snuff, among others. Heavy drinking, excessive sun exposure on your lips, a sexually transmitted disease called human papillomavirus, HPV. The immune system is weak. Prevention. There is no proven way to prevent oral cancer. However, you can reduce the risk of oral cancer if you stop using tobacco or don't start. If you smoke, stop. If you don't use tobacco, don't start. Using tobacco, whether you smoke or chew, exposes the cells in your mouth to harmful chemicals that cause cancer. Drink alcohol in moderation, if any. Chronic alcohol abuse can irritate the cells in your mouth, making them more vulnerable to oral cancer. If you choose to drink alcoholic beverages, do so in moderation. For older adults, that means 1 drink per day for women of all ages and men over the age of 65, and up to 2 drinks a day for men 65 and under. Avoid excessive sun exposure on your lips. Protect the skin from your lips in the sun by staying in the shade where possible. Wear a wide-brimmed hat that works well with your entire face, including the mouth. Include oral sunscreen as part of your regular sunscreen program. See your dentist regularly. As part of a routine dental examination, ask your dentist to examine your entire mouth for unusual areas that may indicate oral cancer or premature changes. Oral cancer diagnosis tests and procedures used to detect oral cancer include physical examination. Your doctor or dentist will examine your lips and mouth to check for abnormalities, areas of irritation, such as sores and white spots, leukoplakia. Tissue removal, biopsy. If a suspicious location is found, your doctor or dentist may remove a sample of the cells for a laboratory test called a biopsy. The doctor may use a cutting tool to cut the tissue sample or use a needle to remove the sample. In the lab, cells are analyzed for cancer or premature mutations that indicate the risk of future cancer. Determining the severity of the cancer. When cervical cancer is diagnosed, your doctor works to find out how much cancer your stage cancer is. Oral stage tests may include you are using a small camera to check your throat. During a procedure called endoscopy, your doctor may move a small, flexible camera mounted down your throat to look for signs that the cancer has spread beyond your mouth. Testing test. Various imaging tests can help determine if the cancer has spread beyond your mouth. Imaging may include X-ray, CT, MRI and positron emission tomography, PET, scans, among others. Not everyone needs to be tested individually. Your doctor will determine which tests are appropriate depending on your condition. The stages of oral cancer are shown using Roman numerals I to IV. The lower stage, like the first stage, shows a small amount of cancer confined to one area. The advanced stage, such as stage 4, indicates advanced cancer, or that the cancer has spread to other areas of the head or neck or other parts of the body. Your cancer category helps your doctor determine your treatment options. Treatment. Oral cancer treatment depends on the location of your cancer and your stage, as well as your overall health and preferences. You may have one type of treatment, or you may have a combination of cancer treatments. Treatment options include surgery, radiation and chemotherapy. Discuss your options with your doctor. Surgery. Oral cancer surgery can include surgery to remove a tumor. Your surgeon may determine the tumor and the line of healthy tissue around us to ensure that all cancer cells are removed. Minor cancer can be removed with a little surgery. Larger tissues may require additional procedures. For example, removing a large tumor may involve removing part of your jaw or part of your tongue. Surgery to remove cancer that has spread to the neck. If the cancer cells have spread to the lymph nodes in your neck, or if there is a high risk of this happening depending on the size or depth of your cancer, your surgeon may recommend a procedure to remove the lymph nodes and connective tissue in your neck. Neck dissection. Neck splitting removes any cancer cells that may have spread to your lymph nodes. It also helps determine if you will need additional treatment after surgery. Surgery to rebuild the mouth. After surgery to remove your cancer, your surgeon may recommend reconstructive surgery to rebuild your mouth to help you regain your ability to speak and eat. Your surgeon may insert a skin, muscle, or bone graft from other parts of your body to reconstruct your mouth. Dental implants can also be used to replace your natural teeth with your own teeth. Surgery puts you at risk for bleeding and infection. Oral cancer surgery often affects your appearance, as well as your ability to speak, eat, and swallow. You may need a tube to help you eat, drink and take medicine. For temporary use, the tube can be inserted into your nose and abdomen. For a long time, the tube can be inserted into your skin and stomach. Your doctor can refer you to a professional who can help you deal with these changes. Radiation therapy. Radiation therapy uses high-energy radiation, such as X-rays and protons, to kill cancer cells. Radiation therapy is usually delivered from a machine outside your body, external radiation. Although it may come from radiation seeds and cords placed near your cancer. Brachytherapy. Radiation therapy is often used after surgery. But sometimes it can be used alone if you have early oral cancer. In some cases, radiation therapy may be combined with chemotherapy. This combination increases the effectiveness of radiation therapy, but also increases the side effects you may experience. In cases of advanced cancer, radiation therapy can help reduce the symptoms and signs of cancer, such as pain. Side effects of radiation treatment in your mouth can include dry mouth, tooth decay and damage to your jaw. Your dentist will recommend that you visit a dentist before starting radiation therapy to ensure that your teeth are as healthy as possible. Any unhealthy teeth may need treatment or removal. A dentist can also help you understand how to take better care of your teeth even after radiation treatment to reduce the risk of complications. Chemotherapy. Chemotherapy is a treatment that uses chemicals to kill cancer cells. Chemotherapy can be given alone, in combination with other chemical drugs or in combination with other cancer treatments. Chemotherapy can increase the effectiveness of radiation therapy, so this is often combined. The side effects of chemotherapy depend on which drugs you receive. Common side effects include nausea, vomiting and hair loss. Ask your doctor what side effects you may be experiencing. Targeted drug treatment. Targeted drugs treat oral cancer by modifying certain aspects of the cancer cells that increase their growth. Targeted drugs can be used alone or combined with chemotherapy or radiation therapy. Cetuximab, Erbitux, is one of the most effective treatments for oral cancer in some cases. Cetuximab stops the activity of a protein found in many healthy cell types, but is more common in certain types of cancer cells. Side effects include rash, itching, headache, diarrhea and infections. Some targeted drugs may be an option if conventional therapies do not work. Immunotherapy. Immunotherapy uses your immune system to fight cancer. Your immune system may not attack your cancer because the cancer cells produce proteins that blind the body's cells. Immunotherapy works by disrupting that process. Immunotherapy drugs are usually reserved for people with advanced oral cancer who do not respond to standard treatment. Lifestyles and homes. Stop using tobacco. Cancer of the mouth is closely related to tobacco use, which includes tobacco, tuberculosis, chewing tobacco and snuff, among others. Not everyone is diagnosed with oral cancer using tobacco. But if you do, now is the time to stop because tobacco use makes treatment less effective. Tobacco use makes it harder for your body to recover after surgery. Tobacco use increases the risk of cancer recurrence and future cancer. Quitting smoking or chewing can be very difficult. And it is especially difficult when you are trying to cope with a stressful situation, such as cancer diagnosis and treatment. Your doctor can discuss all of your options, including medications, nicotine replacement products and counseling. Stop drinking alcohol. Alcohol, especially when combined with tobacco use, greatly increases the risk of oral cancer. If you drink alcohol, stop drinking. This can help reduce the risk of developing secondhand cancer. A different tree. There are no concomitant or alternative therapies that can cure oral cancer. But complementary therapies may help you to cope with oral cancer and other side effects of cancer treatment, such as fatigue. Many people undergoing cancer treatment are tired. Your doctor may be able to treat the underlying causes of fatigue, but the feeling of complete exhaustion may persist despite treatment. Concomitant therapies can help you to cope with fatigue. Ask your doctor about the experiment. Exercise. Try to exercise well for 30 minutes on most days of the week. Moderate exercise, such as brisk walking, during and after cancer treatment reduces fatigue. Talk to your doctor before you start exercising, to make sure it is safe for you. Massage therapy. During a massage, the massage therapist uses his hands to apply pressure to your skin and muscles. Some massage therapists are trained to work with people with cancer. Ask your doctor the names of massage therapists in your community. Rest. Activities that help you feel more at ease can help you to cope. Try listening to music or writing in a journal. To begin with, during a surgical session, a trained physician inserts a small needle into your body. Some acupuncturists are trained to work with people with cancer. Ask your doctor to recommend someone in your community. Dealing with support. As you discuss your cancer treatment options with your doctor, you may feel frustrated. It can be confusing, as you try to accept your new diagnosis, and you are pressured to make medical decisions. Deal with the uncertainty by controlling your actions. For example, try to learn enough about oral cancer to make treatment decisions. Make a list of questions to ask at your next appointment. Bring a tape recorder or a friend to help you take notes. Ask your doctor about reliable literature or websites you can turn to for accurate information. The more you know about your cancer and your treatment options, the more confident you will be when making treatment decisions. Talk to other cancer survivors. Connect with people who understand what you are going through. Ask your doctor about cancer support groups in your community. Or contact your local chapter of the American Cancer Society. Alternatively, online message boards, such as those run by the Oral Cancer Foundation. Take your time. Set aside time each day. Use this time to clear your mind of your cancer and do what you enjoy. Even a brief break during a day full of tests and tics can help you cope. Keep family and friends close. Friends and family can offer you emotional and practical support as you go through treatment. Your friends and family will ask you what they can do to help. Take them with their offer. Think ahead about ways you would like help, whether it is asking a friend to cook for you or asking a family member to be there when you need someone to talk to. Preparing for your appointment. Make an appointment with your doctor or dentist if you have any signs or symptoms that are bothering you. If your doctor or dentist finds that you may have cancer of the mouth, you may be referred to a periodontist or otolaryngologist. Because appointments can be short, and because there is often a lot of ground to cover, it is a good idea to prepare well. Here are some tips to help you get ready, and what to expect from your doctor. What you can do. Know any pre-appointment restrictions. When making an appointment, be sure to ask if there is anything you need to do in advance, such as cutting back on food. Write down any signs you encounter, including any that may seem out of place in your decision-making process. Keep notes of key personal details, including any major stressors or recent life changes. Make a list of all the medications, vitamins or supplements you take. Consider traveling with a family member or friend. Sometimes it can be difficult to remember all the details provided during the appointment. Your traveling companion may remember something that you missed. Write down the questions you will ask your doctor. Your time with your doctor is limited, so preparing a questionnaire can help you to make the most of your time together. Make a list of your most important questions to the most important ones at the end of the day. With oral cancer, some basic questions to ask include: what causes my symptoms or condition? What are some of the causes of my symptoms or my condition? What types of tests do I need? Could my condition be temporary or incurable? What is the best way to do it? What are some of the ways in which you recommend it? I have some of these health conditions. How can I treat them better together? Are there limits I need to follow? Should I see a qualified physician? What will that cost, and will my insurance pay for it? Are there any brochures or other printed material that I can take with me? Which websites do you recommend? What will determine if I should plan my next visit? In addition to the questions you have prepared to ask your doctor, do not hesitate to ask any more questions from yourself. What to expect from your doctor? Your doctor may ask you many questions. Being prepared to give a reply may allow some time later to cover the points that you want to cover. Your doctor may ask: when did you first experience symptoms? Have your symptoms been persistent, or from time to time? How bad are your symptoms? What, if anything, seems to improve your symptoms? What, if anything, seems to make your symptoms worse? Have you ever smoked? Do you drink alcohol? Have you ever received radiation treatment for your head or neck? What you can do right now: avoid doing things that make your symptoms worse. If you have pain in your mouth, avoid spicy, hard or acidic foods that can cause persistent irritation. If you have an eating disorder because of pain, consider drinking nutritious drinks. This can give you the nutrition you need until you can see your doctor or dentist.